Hi everyone, my name is Megan Brown and I chose my topic on obesity for the healthcare resolution paper. Several factors have contributed to the growing rate of the obesity epidemic. It cannot be solely explained by sudden changes in genetic background and is mainly attributed to lifestyle modification. The recent trend toward increasing obesity prevalence can be attributed to overnutrition and sedentary behaviors, as well as convenient fast food restaurants. Other factors, including societal, economic, cultural beliefs, and even genetics, have been considered a significant contribution to the spread of obesity. Children of obese parents are at even higher risk for developing obesity due to genetic and environmental factors such as high food consumption, high sweetened beverages, fast food, less physical activity, and television watching. Starting in the 1990s, the FDA required food packaging labeling, which include the identity, product's weight, manufacturer's address, nutrition facts, and ingredient list. In 1992, the U.S. Department of Agriculture created the Food Guide Pyramid. In 2011, it was updated to the My Plate. Michelle Obama even started a Let's Move campaign in 2010 to raise public awareness about the problems of childhood obesity by urging kids to be more physically active. To decrease obesity in children, the government even limited the proximity of fast food restaurants toward schools, banned trans fat in restaurants, and limited high-caloric, low-nutrient food marketing to children and individuals. My target audience is advanced practice nurses. Obesity management should begin in primary care with the advanced practice nurse. They are skilled in utilizing motivational interviewing and skilled decision making to facilitate effective communication and partnership with patients. Through education and training, advanced practice nurses are on the front lines of the obesity epidemic and can collaborate with patients to reach individual healthcare goals by assessing, diagnosing, educating, and counseling patients on effective strategies for prevention and management of obesity. The psychological, biological, and economic impact of obesity can be devastating. So the initial goals of the advanced practice nurse is to inform the patient of present body weight related to health standards, to clearly convey the health risks associated with excess weight gain, and explore the patient's motivation and readiness to engage in weight control, elicit barriers to behavioral change, and establish practical lifestyle changes and short-term goals. Amongst the public health crisis of obesity, the duty of the healthcare of the advanced practice nurse is to positively impact patients' health through education, political activism, and research in order to decrease the steadily rising morbidity and mortality rates associated with obesity. In the United States, the prevalence of obesity is steadily rising and growing concerns for healthcare professionals. According to the Centers for Disease Control, the prevalence of obesity in 2016 was approximately 39.8% and affected 93.3 million people in the United States. The global obesity epidemic reached a pinnacle of concern on June 18, 2013, when the American Medical Association ruled obesity a disease state with multiple pathological facets requiring a range of interventions for treatment and prevention. Obesity can cause several health-related conditions that includes heart disease, stroke, type 2 diabetes, and certain types of cancer that are some of the leading causes of preventable and premature deaths. Obesity not only causes health-related problems, but can also increase medical costs. In 2008, the estimated annual medical cost of obesity in the United States was $147 billion, with the medical costs for people with obesity being $1,429 higher than the people of normal weight. More Americans are relying on federally funded nutrition assistance programs, with 14.5% of the United States household labeled food insecure. And this is defined by the U.S. Department of Agriculture as a household level economic and social condition of limited or uncertain access to adequate food. So my resolution plan is, in order to reduce obesity, the federal agencies such as the U.S. Centers for Disease Control and Prevention, the national and non-governmental organizations such as the AMA, The Endocrine Society and the Obese Society can promote guidelines and best practice in prevention and treatment of obesity. Insurance companies can provide reimbursement of obesity-related treatments in state Medicaid and state employee and retire health benefits such as free BMI screenings and obesity treatments. Encouraging schools through the Department of Education and other agencies serving children to implement plans and policies to improve nutrition, increase physical activity, and increase quality health and physical education among children as fundamental and foundational aspects of the educational policy. Involving key stakeholders in implementing prevention strategies and enforcing policies through community involvement will impact obesity levels and promote healthy lifestyles. The medical community, such as advanced practice nurses, can set examples of healthy behaviors by being role models and can become active in national organizations to combat the rising rates of obesity in today's society.